And welcome back. Once again, live from the Physicians Center for Beauty. We are Wave 3 Listens Live. Liposuction of the neck is the topic. Doc, I think I need it because, you can choke me to death now with one hand. It's like right here, But anyway, so liposuction of the neck. What is the difference between lipo of the neck and a complete facelift? I mean, what's the difference?
There's a big difference. Liposuction of the neck is a much less invasive procedure, and it's a shorter procedure. There's really very little downtime. It's 2 stitches right underneath the chin, a little bit of bruising and swelling, but it's facelift is a different procedure entirely, and there's a lot more in terms of downtime. Neither of them are terribly painful procedures, but liposuction of the neck in particular is just a quick recovery procedure, and it's really good for someone that does have some fat in the neck, sort of a double chin, and has some loose skin. And we can get a lot of skin tightening with liposuction of the neck, and we're going to show some examples of that. It's sometimes surprising how much skin tightening I'm able to achieve with just liposuction, for the right person, depending on the status of their skin. So we can go through a couple of examples. Someone that basically has a double chin that just has a little bit of loose skin. You can see it, I think, on a side view sometimes better than a front view, what the difference that we're able to achieve. This kind of skin tightening that we're able to get with a fairly minor procedure with minimal downtime.
So is this due to just the effects of aging, or is it genetics, or maybe a little bit of both, Doc?
Yeah, I mean, I think some people hold excess weight in different areas, and some people in particular will hold excess weight in their neck, and sort of that double chin. It certainly can be genetic or hereditary, lifestyle, and if the skin, and I can usually determine if the skin is in good shape, and I expect enough skin tightening. A lot of times we can do, just with liposuction, a significant improvement in skin tightening of the neck without doing a more comprehensive, extensive procedure like a facelift.
That's where your experience and expertise comes in hand, because I would think a lot of plastic surgeons would not be able to do that, because you know exactly how this works.
I mean, I do have a lot of experience doing procedures for the face and neck, and liposuction works well for a lot of people. It's not the answer for everybody, but it is surprising sometimes. Sometimes I'm surprised how much skin tightening we're able to get with just a liposuction procedure.
These are amazing results. You know what I love here? Male and female. Thank you very much. We are represented here, Doc.
Yeah. No, I mean it is a common issue for not only women but also men. And as men are becoming more aware of some of the things that we're able to do. They tend to do less invasive procedures with less downtime, but it's a good procedure, I think, for the right individual, whether a man or a woman.
Okay, now obviously this is a little bit invasive here, liposuction of the neck. So with that being said, does the consultation take place here? Does the actual procedure take place here at the Physicians Center for Beauty? How does that work?
Yeah, well, I see all my patients in consultation here at the office, and then if it's a procedure like liposuction, which is a minor surgery, we do that at an ambulatory surgery center, an accredited surgery center, not here in the office. So I don't do any surgery in the office. This is all done at a surgery center with board-certified anesthesiologist, but this is an outpatient procedure.
Okay, now where is that fine line between like an old therapy or a sculpture and a liposuction procedure?
Yeah, I mean we're putting finer points on things, but if the issue is mostly excess fat, obviously that's more something that liposuction would be best suited for, with a little bit of skin tightening needed, perhaps. Liposuction is probably a good option. If it's really just an issue of a little bit of skin laxity or looseness, a little bit of excess skin, and sagging skin, then old therapy might be a better option.
All right, once again, if you are interested in one of the procedures that you've seen today, whether it be sculpture, old therapy, liposuction of the neck, or many of the other procedures that they offer here at the Physicians Center for Beauty, you can go online or you can call the number that we're throwing up on the screen, the Physicians Center for Beauty. Okay, Doc, I talked about how busy this time of year might be. As you see this business, the skin industry, plastic surgery, liposuction, old therapy, whatever it may be, as you see it evolve, I always like asking medical experts like yourself questions like, what do you see on the horizon one that you find exciting, that you go, okay, this could be really good?
Well, I think it's all exciting. I mean, I love, I love doing surgery. Obviously, as a surgeon, you'd expect me to feel that way. But some of the newer advances that we've made just in the last 10 years with injectable dermal fillers,
yes,
the neuromodulators, things like Botox and Dysport, which are injectable treatments done in the office. That's still fairly new. We've been doing it now for about 15 years, but it's still an emerging field. There's still new products coming to market with dermal filler injections, for example. There's a newer injectable procedure for fat reduction or double chin with an injection, which I think we've talked about before. And then some of the newer technologies, the non-invasive technologies like we've demonstrated today, the Ultherapy, the Sculpture, the Cool Sculpting. These are all new devices which are very exciting.
All right, once again, give them a call today. Make an appointment, if you would, please. Physicians Center for Beauty. Have a great day, and we'll see you tomorrow on Wave 3 Listens Live.